Hello there, I'm Dr. Brian Prax, author of Reversing Neuropathy, Making the Impossible Possible. And today our topic is neuropathy versus nerve compression. What are the key differences? Right off the bat, let's just do a little Greek here, okay? Neuropathy. Neuro means nerve. Pathy means pathos or suffering. So neuropathy means that your nerves are suffering. In Western medicine, when we do diagnosis, pathy will also mean like a nerve condition, but you can also think of it like a problem with. Okay, so your nerves are suffering. You have a problem with your nerves. Now, to add on to this word, if we really want to complicate things, we talk about peripheral neuropathy. So don't get too confused there. It's real simple. Anything in the center of your body, anything nervous system related, which is the brain and the spinal cord, that would be the central nervous system. Okay? And anything peripheral to that or outside of that would be the peripheral nervous system, like the nerves that leave the neck and go down into the arms, the hands, and the fingers. The nerves that leave the lower back and go down into the legs, the feet, and the toes. But there's also the nerves that leave the brain, okay? And some of those go all the way down to the gut, the heart, controls digestion, etc. Some nerves leave the spine and go to our internal organs as well. That would be called the autonomic nervous system. There's other videos where I explain more about that, but the topic for today is neuropathy. So under the umbrella of neuropathy, we're going to find nerve compression. So if neuropathy means that a nerve is suffering or you have a problem with it, one of the ways that a nerve can suffer is with nerve compression. If a nerve is compressed, think of it like a hose. If a hose is kinked, you're going to have a problem. Okay? If it's the hose, the water isn't running out as well as it should at the end of it. If it's a nerve, the nerves aren't flowing. And what's interesting, unlike the hose, the nerves can flow one way and then they can flow the other way. So some information is going from the body up to the brain and some information is going from the brain down to the body. But a nerve compression, it can happen in many different ways. It can have a bone that's compressing the nerve, like the nerves that leave the lower back and go down the legs. The most infamous one would be the sciatic nerve. If we have compression on a sciatic nerve, we call it sciatica, and that's a form of nerve compression that is under the umbrella of neuropathy. So they're really both one and the same, but neuropathy is a more general term. So bones like arthritis, scoliosis, slippages of vertebrae, broken bones, compression fractures, bones and bone problems can cause compressions on nerves. Muscles can actually cause compression on nerves. There's this thing called piriformis syndrome. Piriformis is a muscle. Sometimes the sciatic nerve will run right through the muscle, and if the muscle is in a spasm, then the muscle itself can compress that nerve. So muscles can cause nerve compression. Sometimes we just get muscles that are in spasms. Sometimes we get muscles that have scar tissue in it. Scar tissue is kind of like the gristle that you would get on a cheaper piece of steak, right? You got to saw through that stuff. Well, these scar tissues or adhesions, those can actually cause compression on nerves. Tendons can be tight, spasms, scar tissue, adhesions involved in those, and muscles, or rather nerves, if they go through those, that can cause a nerve compression. Cartilage. So cartilage can cause nerve compression as well. Some of the most infamous cartilage would be like the meniscus in a knee. Now, there's really not many main nerves that run through the meniscus in the knee, but there's other forms of cartilage itself that can cause that. Sometimes cartilage can turn and become scar tissue, and then the scar tissue can ossify, meaning turning into bone, and then we can have cartilage turn to scar, turn to bone, which can compress a nerve as well. There's lots of other things that can cause compression on those nerves, but tumor, or tumors, whether it's malignant or benign, they can actually put pressure on nerves as well. So these are some of the causes. There's lots of other ones, but these are some of the things that can compress a nerve. That's the story. Nerve compression is a form of neuropathy, and neuropathy means you got a nerve that's suffering. I hope that helps to decipher the key points between neuropathy and nerve compression. Please leave your comments below. What did I miss? What would you like to learn more about? Or just any comments. Really appreciate those. I do read those and I will get back to you. Hope you liked the video. If you did, hit a like, and we look forward to hearing your comments below. Take care. Thank you for watching. If you liked the video, please like it by hitting the thumbs up button down below. Also, you can share it with a friend or family member by hitting the share button. That's the little arrow at the bottom of the video. You might also want to subscribe to the channel. What you're going to do there is hit the little button at the bottom right side of the video. That way, when new content comes out, you'll be the first to know. Lastly, please comment. I'd love to hear your comments. I will read it and I will respond. Thank you and have a great day.